Okay, so the first test we're going to do is the anterior slide test, and for this one, I'm going to have my patient sitting, and she's going to have her hand on her hip with her thumb pointing posteriorly. Her elbow is going to be pointed back like that, and I'm going to stand behind her, and I'm going to have one hand on the shoulder, and then with my index finger over the acromion, and then one hand on the elbow. And I'm going to apply a forward and a little bit superior force through the elbow, and she's going to resist that force. And so like that. And then if she has any increased pain or popping or clicking sounds, we would suspect a SLAP lesion. And it is positive if the patient reports any reproduction of the symptoms they feel while they do overhead activity. So the next one we're going to do is the compression rotation test. For that one, my patient's going to be lying supine with her shoulder in 90 degrees of abduction, and then neutral rotation, so like that. And I'm going to compress and rotate the humerus, so I'm going to push in here, and then rotate this. And this is being done to kind of trap the labrum in that joint. And so if we hear any or she feels any uncomfortable clunk, we would suspect a labrum tear. So the next one is the apprehensive test. And for this one, my patient's going to be lying supine with her arm abducted to 90, with her elbow at 90 degrees of flexion as well. And so for this one, I'm going to support the shoulder and slowly externally rotate her arm. And if this increases her pain at all, we would suspect a SLAP tear again. Next is the Jurgensen's test. And for this one, my patient's going to be sitting. And she's going to have her elbow, just face the camera if you want to. She's going to have her elbow at 90 with her forearm pronated. And so for this one, I'm going to put one hand on her elbow and the other hand at her wrist. And she's going to try and hold this position while I try to externally rotate and supinate her forearm. And so if she has any pain or tenderness in the bicipital groove during this, we would suspect biceps tendonitis. But if she has any pain or snapping during that, it could indicate a biceps tendon sublux of the long head tendon. And pain could also indicate a SLAP tear if we would do other SLAP tests with that. So next is the biceps load test. For this one, my patient is going to be lying supine again. And her arm is going to be abducted to 120 degrees with her arm externally rotated and her elbow at 90 degrees of flexion and then supinated as well. And so for this one, I'm going to ask her to flex her elbow, and I'm going to resist that motion. So she's flexing, and I was resisting. And so for this one, if she has any increased pain, we would suspect a SLAP lesion, and that's because the bicep is pulling on that superior part of the labrum, which is causing her pain. And for this one, the patient could be experiencing some of that pain in the starting position, but the test is only considered negative if the pain was unchanged or decreased during that flexion. Well,